Yes, another great question. And I would say that there are a lot of threats to the care of patients, not just those who are on clinical trials, but we are still not yet seeing all of the impacts from some of the changes that have happened with the Affordable Care Act and some of the proposed cuts to Medicaid, and the new work requirement that is going to be rolled out for Medicaid participants. But I can say that I and many of my colleagues within hematology and oncology are very worried about these potential changes for our patients. Patients who have acute myeloid leukemia, the blood cancer that I predominantly care for in my patient panel. These patients are coming in and out of the hospital with regularity for at least a period of approximately 6 months. They need to be in the hospital to get intravenous chemotherapy. They may need to have extra time in the hospital or be readmitted to the hospital if they have infections. And even when they're discharged from the hospital, they're coming into our outpatient clinic multiple times per week to have their lab studies monitored and also frequently to receive transfusions of red blood cells or platelets. So it's a really, really challenging time for these patients. And the idea that they would have to go through and submit paperwork to say why they might not be able to work during this time in order to protect their access to government funded insurance programs such as Medicaid, really to me as a treating physician seems like a very unnecessary and time consuming and hassle filled burden for patients who are already often stretched close to the breaking point, dealing with a really challenging diagnosis and the treatment for it. I would like to say that I try to maintain optimism even in the face of threats, knowing that our community of clinicians and researchers within hematology and hematologic oncology are really united in our goals to try to provide the best care possible for patients, whether that's for the patients in front of us in the clinic office or in the hospital setting, and additionally for those patients in the future who are the ones that we are definitely working to help with some of our clinical trials. I also want to call out that I am a member of the American Society of Hematology, which is the professional organization for hematologists. And ASH has an initiative known as the Fight for Hematology, which aims to protect federal funding and restore federal programs and protect access to care. They also, as an organization, have put their money where their mouth is. So in the past year, they've committed more than $12 million to address research funding gaps and to support the next generation of hematologists. So very grateful to be part of an organization that is really stepping up to fill the gap when the institutions that we have counted on in the past from the government and elsewhere are not supporting our patients and our research in the same way as we would like them to be able to continue to do in the future.